Hello, I'm Mallie Shansfeld, Managing Editor of Orthodontic Practice US, a MedMark publication. Welcome to a live presentation and question and answer with Dr. Blake Davis. In our webinar today, we will be exploring how LightForce transformed his practice to be 100% digital, and he'll share effective mechanics in case management using 3D printed brackets. Before we get started, I'd like to invite viewers to use a question box in your control panel to ask any questions, and your questions will be answered at the end of the session. Also, associated with this presentation is a free CE quiz. At the end of the webinar, we will email all attendees instructions on how to access the CE quiz. I'm pleased to introduce our guest for today, Dr. Blake Davis. As a board-certified orthodontist, Dr. Davis specializes in treatment for children and adults. He completed dental school and his orthodontic residency program at the University of Washington. Since his graduation, Dr. Davis has demonstrated an incredible dedication to his practice and to the profession of orthodontics. He is an affiliate faculty at the University of Washington Department of Orthodontics and president of the Washington State Society of Orthodontics. He's a lecturer at the University of Washington School of Dentistry and a published author in orthodontic and dental peer-reviewed journals. Dr. Davis, we turn the webinar over to you to learn more about our topic for today.
Thank you to everyone who's joining us today. We really appreciate it. We're here to talk about my road to 100% digital practice. My name is Dr. Blake Davis, and I practice in Kirkland and Redmond, Washington. I have two private practice locations, and I split my time between the two of those. I'm the only doctor in the practice, so this frankly has been a really big deal for me to figure out how do we change the capacity in our practice and how do we really improve efficiency with customization. I also teach at the University of Washington and have lectured around the country about some of these topics. And so I really feel strongly that this is the way forward for all of us. And hopefully you're going to gain a few insights today about how to evolve with your practice. So this was a really big date in my practice, March 23rd, 2020. As many of you know, we had just been asked to shut our doors. And for us, we'd spent the last week or so working at every level to continue to take care of our patients. What that meant was that we had to turn ourselves into what was a largely analog setup to a virtual practice. And so we really worked our tails off. And I was so proud of the team to get to this point where we were now ready to take care of our patients virtually. So I woke up, got ready, showered, I had hair and makeup ready to get me started. I felt a little bit like a news anchor there, wearing shorts with a tie on. And that's my son Cameron helping us out. At 8:45, I was prepping for patients. I had about 12 patients scheduled that day. And by 8:59, I was ready to go. We had planned to see patients from about 9 to noon virtually, and most of these patients were our aligner patients. So up first that day was Ellie. Ellie's a sweet little girl. She's in first stage aligners. And as you can see, we really need to help keep her motivated during the process in order to close that diastema and address the constriction, the impinging overbite, and the lip entrapment. And so for her, my message wasn't so much keep wearing your aligners. It was what do we need to do to demonstrate to you how you're going to get from the point you are now to the finish line. And so Ellie sent in her photos to me. And here they are, really cute kid. And so she, at this point, was on like aligner number 10. And so what we're doing at this point is just giving her more aligners, making sure things are fitting, things are tracking the right way. And so what we did is I sent back a message, basically thanking her for submitting her Invisalign check. But one of the things that I started to do during this time and with Ellie was I started showing them how and why we needed to go from where they were to the finish line. And so for many of these patients, I started sending them their ClinChecks. As you can see here, this is an example of how we're retracting, intruding, expanding. And so the amazing thing, and the effect I never really realized, but this actually did a better job of motivating our patients because they actually had a visual sense of what we were trying to achieve. So as you look here, this was actually her later on in treatment as she came back, as we reopened our doors. And pretty amazingly, she did done a great job. So you can see that diastema is now closed, she's retracted, and we're no longer impinging on the roof of the mouth. And so I really sensed that things were better as we were giving our patients more information and more visual information. So now let's talk about the next day. So again, rinse and repeat. We went ahead, hair and makeup. I prepped, I got ready. By 9 o'clock, I'm ready to go. So on our second virtual day, we saw Rin. Rin's another really sweet girl. She's also an Invisalign. She's an Invisalign teen. And at this point, we're trying to finish up her treatment. So Rin started with a class 2 malocclusion. And what I explained to Rin was, right now, the tips of your teeth line up with the tips of your teeth. But we want the tips to fit in the grooves like puzzle pieces. And so I sent her this diagram showing how we want those yellow lines to line up. And to my amazement, or maybe I shouldn't have been amazed at this point, when we saw her back in the office in person, she had achieved a class 1 occlusion. And so here she was that day when she came in, and you can see smiles improve. We've retracted, achieved a better overjet and overbite. And, everything's at a point where now we're almost ready to be finished up as we finish up our aligners. So I think what we really realized during this period is that we did better than we really thought we could over a screen virtually. But so much of that was the fact that we were now connecting with our patients in a very different way. And it was a more personalized way, because we were digging in and showing them examples and really realizing the benefits of clear visual communication. So what we also took away from this was that our aligner treatment worked much better in a digital or virtual form than our fixed appliance treatment. At this time, I was using self-ligating brackets, which I still really love. I think there's so many benefits. But with that said, it was clear to me that most of my patients who were making progress in treatment were the ones that were using aligners, not our fixed appliances. And I think all of us have this balance in our practice, what works for us, how we blend aligners with our braces. For some of us, we're 50-50. For some of us, that really depends on if we're seeing adults or more kids. And for some of us, we have a very different comfort level in terms of how complex we're willing to get with aligner treatment and what we're able to do with our fixed appliance cases. For me, what that meant was that I had to really think about, how do I achieve a balance that made sense for both my brackets and my aligners if I'm going to continue to operate at this level. And so pretty much every day after 12 o'clock, when I finished up seeing patients virtually, I'd jump on the Peloton bike and the wheels would be spinning. And over the weeks, and months that all of us were closed, I started to really think about, how do we create the same experience with braces as we're creating with aligners? And what I realized is that we had to become a 100% digital practice. And so today what we're going to talk about is really just my roadmap to go from where we were to where we are now. And so there's a number of things that I think that you guys are probably already doing in your practice that we were really doing at that time as well to become a digital practice. And it really started with the digital onboard. And what I mean by that is, rather than sending your patients forms to fill out, having paper copies of everything, or basically being a practice that functions primarily over the telephone, we had to be committed to doing everything in a digital way. What that meant is, from the very beginning, with our signatures, for our health history, for payment, everything had to be capable of being done either at home or in the office digitally. As far as communication, I'm in an area where people are very tech savvy. And so people really primarily communicate over text. And so we had to really work on creating ways to communicate, not just over the phone, but also through email and text. And then also creating special ways to make our practice stand out. And so, for instance, in some cases, we would link a video with some of our initial texts or our reminders, just to say, hey, we're here. It's kind of like, I know a lot of people put stickers or badges with their face on there when they're wearing a mask. And I think that went a long ways to humanize people. I think the same thing's true when people initially see you. If you send a video over at the same time, then you're able to say, oh, I know that person. I've met them in a sense. And so again, that was really important because we were essentially meeting them at the door at that point to record their temperature, which is not a great way to enter somebody into your practice. And so with that, again, just like many of you, we also had to carry that into the clinic. And so we're doing digital records, scans, everything to allow us to really have this digital platform. So we're onboarding our patients the right way. So we wanted to create the same experience as we welcome new patients into the practice. So we had to continue the same concept in our new patient exam. And what that really meant is at that point, I had to be 100% committed to customization. It was no longer about braces or aligners. It was really about what is the best custom appliance for you and for your treatment and your care. And so as soon as we did that and we kind of jumped in the deep end and really committed to either just aligners or custom braces, I think it also resonated throughout the team because that's when I recognized that everyone was committed to a whole different experience. And so for us, what that meant is we were no longer really talking about, stock brackets. In fact, I think lots of times when you explain to patients, they said, well, why would we even be looking at the stock brackets based upon all the benefits of a custom bracket? I would honestly say we just have these out so you can have a comparison. Because lots of times when we're talking about treatment time, efficiencies, appointments, there is no real comparison. And so at this point, it was a lifestyle choice. What experience do you want? Do you want the aligners or do you want the braces? No longer about the other kind of analog approach. And so in this situation, it's pretty easy to tell people why custom is better. I mean, we can just show photos. Take this case. This is his first adjust back after 4 months in treatment. And the mom looks at me and says, is he done? Because honestly, to most people, teeth are beautifully aligned. We're out of crossbite. We've already gotten great arch development. Obviously, we still need to work on the bite, but this is why custom is so much better because you see some of these early efficiencies with alignment. It's the same thing when we're talking about the smile. There's a huge difference when a patient walks in and sees and feels differently in such a short period of time because they're motivated to continue and to really get that great result. We talk about a lot in my practice, but it is especially, kids and adults hit the 14 to 18th month mark, they really start to fatigue. And so if we can get a lot of the work done early on, we're going to be much more successful in getting a better outcome. And this is really nothing new when we're talking about brackets, when we're digitally modeling where we want the teeth relative to the smile. This is something we've been doing with our aligner cases. And there's a clear benefit to modeling the care. Because like we talked about before, not only are you setting things up with certain precision, but you're also communicating with your patients in a way in which they can understand what the end goal is. And that's really the big thing is you want to think about how do we get to the end in mind? And so this is a patient that I was just showing with the modeling where this was Invisalign on the upper and lower, 14 months of treatment, and she came in for 8 appointments. And this was a great result even 1 year later as we brought her back and took photos and everything had really held up. And so, this was a type of case where years ago, I think people wouldn't even anticipated that we would have fully corrected end-on class 2 overbite where we had a constricted envelope. But now this is the reality as we're getting better and better with our digital treatment plan setups. So then let's talk about the start, because I think this is a really key concept and something that we modified or changed in our practice immensely. Previously, what we were doing is we bring people in, we talk about different payment options. And once we stopped doing that with paper, I think it really set us free. And we were able to actually help this process become a more similar or seamless process when we're talking about braces and Invisalign. It wasn't so challenging to say, okay, we need to carve out 60, 70 minutes for a 2-arch bonding versus we're going to do an Invisalign scan. Now everyone really starts with digital records. And so the same core concept is what carries through every patient start in our practice. And that's a really big deal because That way, I'm able to review everyone's records. I'm able to make sure that I can sit down, evaluate, and give really what hopefully is the best possible care for our patients. So once we do that, the way we get started now is it's a digital contract start. So we're not necessarily sitting there or bringing them in for a separate contract signing. All the consent forms, everything about the health history now is on our digital platform. And so once they've committed to treatment in our practice, then it's my job to go through the digital treatment plan. And so what we did was we created responsibilities in the practice. And this is just our example. You can easily come up with something similar. We've worked with Schumann Consulting to do this, but essentially we tried to create a timeline or a course of action that allowed everyone to understand their role in this process. So we estimated in this situation 18 months of treatment time on average. That was kind of a few months less than what our standard bracket case had been previously with the self-ligating brackets, which I think was somewhere around 20. With that said, I think in the cases we're finishing up now, it's probably a little shorter than that. But I still think 18 months is a good number because, again, people really fatigue after that 1.5 year mark. And so you can just see here, we start with the exam, we get our digital records. Once they've committed to treatment, we have a timeline for when we're going to schedule them. We are using MeisterTask in this case to keep ourselves organized. And then what we're doing is I'm working on the case and doing the digital setup and approving it. And the nice thing, and you'll notice this when we compare LightForce to how my responsibilities exist with Invisalign aligners, you will see a little bit of a difference. Because as I bring up the Invisalign workflow, and this is, again, something we created with Schumann Consulting, is theoretically, in our practice, we're doing about an average 1 refinement. But if I need to do a second refinement, now we're talking about multiple points of contact in which I have to work through a digital setup. And so one of the obvious differences there is that with the LightForce, we're actually having fewer touch points from the doctor. And I think that's a big thing, especially if you're able to really train well in the clinic. So this is how I go through the process of setting up a digital treatment plan. So let's take Jen as an example. Jen came in, really, really great person. For years, she wanted to do something about her smile. She really didn't like the excessive gingival display, didn't like the short teeth, felt like she had a narrow dental arch, a narrow smile. And then, of course, as you look at her photos, you'll see what's going on with her class 2 malocclusion and overbite. And so for Jen, what we wanted to do was come up with a digital treatment plan that not only is a good way for me to make sure that my diagnosis is correct and come up with the right plan, but it's also a way to communicate to the team. So now we have this digital roadmap per se. And so as you can see, and as I was talking about for Jen, we'd like to move those teeth up. And so we talk about this. Here's how we want to move the teeth. Here's where they're going to go to give you the best possible result for your smile. And so in this case, then we're thinking we need to go up and out. So in our practice, what's going to take care of that best? We're going to discuss gummy smile treatment, and we're going to go ahead and put some TADs in after early alignment. And so you can see with the modeling, we also recognize too, and you can see this with the simulation, the purple being the initial and the actual white tooth being the end result, that we need to get class 2 correction here. And so what you're seeing is that I also need to think about where am I placing TAD so that I'm able to retract as I'm doing that, as I'm intruding and expanding, and then also allow those lower teeth to come forward as much as possible. And so again, what we now see is that I'm going to go ahead and put the custom bite turbos on in the light plan setup. And then we're going to plan for class 2 elastics. And those are all things we're communicating at the outset so the techs have an understanding of what you want to do with the case. And that really makes it much easier because they really do a great job. When comparing aligner setups versus light plan setups with LightForce brackets, I think most people would agree that we're spending less time manipulating the light plan than we are with some of our aligner setups. And so with that, now we're creating our digital treatment plan, and then that is our blueprint for the team moving forward. So we're going to use TADs to intrude. We're going to really focus on improving posterior root torque with arch expansion. And that's something now I'm building into the prescription, into the bracket. And then we recognize that we're going to need to do class 2 elastics. So this is really nothing new in our practice. It's the same way we're approaching our clear aligner cases. So we all recognize that open bite cases can be a good indicator for clear aligners, but you really have to diagnose properly, because if this is a situation where you can only extrude anterior teeth for open bite correction, that's probably not going to be a very stable result, even with the aligner cases. That might be a better surgical case, or you might have to find some sort of combination of temporary anchorage devices and or surgery. But in this case, what I recognize is that I could meet in the middle. And so I could intrude the posterior teeth and then extrude to kind of the limits of what I felt like I could do with the clear aligners. And so what you can see is I created these posterior pads for intrusion, and that's something I often will use in these situations. And then, of course, we're able to now execute our digital blueprint. And this was a case that actually finished out in about 12 months, which is great. But again, it speaks to the importance of creating that blueprint up front and having a plan as you proceed forward. And I think, frankly, this is so much better for our patients that we have a clear concept and idea of how we proceed forward. We've been doing it with aligners. Now we have to do it with our brackets. One of the really cool things about positioning teeth in your light plan is that we're really not positioning the brackets. We're positioning teeth. So when you're thinking about setting up a case, you're not thinking so much about the bracket or where it's being placed on the tooth. You're actually thinking about where's that tooth go into the best position for the smile, building around our upper ones, and then for the bite and the occlusion. And so you'll see here, and this is just a little demo of how when you move the tooth, there's a responsive element to the bracket. And that's the base, and you're seeing it reset there. And so it really should reset to the point where you putting in your prescription or positioning the tooth gets you the best possible result for that tooth. The other thing that you will do as you're doing your digital setup is you're going to have to identify where you need the torque expression, what slot size you want, depending on the case. And so for many of us, we were already looking at our cases and saying, okay, this is a high torque, low torque situation, or we need sliding mechanics in the posterior, and then manipulating the case accordingly. Well, now it's really easy, because what you can see here is you have options. So you have an 018, an 020, or an 022 slot. And depending on how you want to engage the wire and express that prescription, you really are setting that up within your initial plan. And so this is just an example of that. This is one where I actually used bidimensional mechanics. So what we did was upper 2 to 2 were 018, and then we're 020 in the posterior. This patient had a very deep bite. We have an impacted tooth number 6, or upper right 3, and a retained primary tooth. And so what we're essentially doing at this point is we're leveling, aligning, we're going to remove the primary tooth, and then we're going to go ahead and retrieve that. And so based upon the position of the tooth, I just used a laser, did a laser gingivectomy, exposed that and bring that in. And that worked really nicely. So you can appreciate, even in our initial alignment, how nicely everything leveled out, because we planned the case digitally up front, and then just as you would expect, you start to achieve those results much earlier. So let's talk about the delivery, because I think that's a really key concept when it comes to the benefits of indirect bonding with LightForce. So I'm going to go ahead and talk a little bit more about why this is an indirect bonding process that can be delegated. So here's a setup that we have in our practice. You can see we have up on the screen our light plan. We have a clear idea of exactly how we want to move those teeth, because now we have a digital blueprint. And then in Sextants, we're going to go ahead and bond the teeth. And so keep in mind, these bonding trays are actually also 3D printed trays in which we get a very, very specific fit on the teeth. And so this is what's really special about the LightForce system, is the IDB process. And it's something that you can really delegate to your assistants with very little training. So in a practice where you've already been doing a lot of aligners, which was the case in mine, we were really easily able to transition to something like LightForce because we were bonding the exact same way. It's really almost the exact same process and setup. And so what you're seeing here is we in our practice are using a NOAA, retracting, we're isolating, starting on those posterior teeth as you're bonding. We're currently using an LCR material, and that's something you can look into more as you actually start to treat the cases. But this has worked very nicely for us. And you can see how accurate it is. So this is an example of my setup. This is literally our first case that we ever did in the practice, a very complicated, complex adult case. And what we're doing is we're recognizing that these brackets are going exactly where I set them up. And again, what means even more in this situation is that then the teeth will go to where I set them up. You can also see here, of course, this is kind of our final position of the teeth, but how we've created essentially this roadmap with clear instructions for the team. So no longer do we have all these questions. And that's, again, why we can delegate, because not only are you going to visualize what we're doing, you can see the deflection in the wire, understand exactly what needs to go in at what time, but you're also looking at this and saying, okay, here are some of the notes back from the tech. And we're really working as a team between the doctor, LightForce, and the assistant. And so I think that is what is really, really cool, is that it's no longer just kind of think about where we want to go. We really have a plan now. And as you can imagine, as I just showed, this is a huge advantage for complex patients. And for many of us, depending on your area, we're not seeing that many class 1 crowding cases come into our offices anymore. And so this is where we really have to get better at treating those interdisciplinary cases, wowing the prosthodontist or the restorative dentist, and showing off what can be done. I have a really funny story, actually. I have a friend who's a prosthodontist, and one of our earlier cases, we were talking about leveling gingival margins, and I had to do some extrusion for him to restore upper anterior teeth. And so we went ahead, saw the patient. She was excited to get going. It certainly wasn't an easy case, but I did it with a LightForce setup. And so he called me about 2-3 months, and he had just seen her for an appointment to update some of the records. And I had told him about these custom brackets, and he calls me and he goes, "What were those brackets called again?" And I started laughing, of course. And I'm like, "They're LightForce." And he's like, "We're pretty much done." And I was like, "I know." Because we set up the position of the teeth for where you want them. This is a prosthodontist, and obviously they're very picky. But that's the whole point here, is we're not dealing with all those extra steps when finishing. And I think that's a big deal. And so there's some definite advantages for our complex patients. Number one, we've talked about this. There's this digital blueprint that everyone can see, and you can include your patient in that. We now are building everything around the smile. And for me, that's a huge thing. When training at University of Washington, big thing that we want to talk about is how do we design best possible smile, and what are the ways that we need to get there. And so I think it's really fun to now do this digitally in a way where we predictably will get there. In many ways now, alignment and leveling becomes more shape directed. So you're thinking more about how do you want to manipulate your arch form? Is this an expansion situation? Is this something where I want to maintain the position of my canines? It really just depends on what you need for that patient, and you're able to deliver a much more personalized or customized treatment with that. And also the added advantage is it really simplifies your biomechanics. So you're no longer thinking about, okay, I got to put this bend and what is the offsetting force when I step in, step out, put torque on like a single tooth or in a segment. Now you're really thinking about more so, what do I need to do to move the teeth to their final position? And then how do I set up my mechanics to get there? So this is just a fun case. This is an adult patient, severe crowding. It was a class 3 malocclusion, but he had a shift. And so it was really a situation where we just needed to remove teeth and then align and retract. And so when you look here, you can see the progress. What we initially did was we stayed off our laterals. That way we started retracting our 3s into the position where we removed the teeth on the second appointment. And at that point, I was seeing them about every 10 weeks. We used open coil springs to make room. And then, of course, we're moving forward, and then we're engaging those teeth. And so this is pretty cool because this is just within, about 6 months that we're able to do that. And so here's an occlusal view. Again, you can see bonded teeth come out. Now we're immediately retracting. That was actually a copper NiTi wire that I was using initially. We went ahead and put the open coils in and then engaged like we talked about. And then again, that's pretty incredible that we're able to get to this point in such an efficient manner. This is another case where, again, you're simplifying your mechanics. So rather than getting into the situation where we're fighting crowding, I went ahead and I expanded. Some of you might use lower expanders as well, depending on the situation. I've tried that. I often found that just using the brackets and changing my torque really helps a lot. And so that's what we did in this case. And so you can see this is pretty amazing, but this is the patient back after the first adjustment appointment. Now, again, we're just thinking about where do we need to get the teeth to get them in their final position using things like elastics, chains more frequently. And because of all this, you really have to change your schedule. There is no way you can continue with the same schedule that you currently have if you're going to customize your practice. And so as we became a digital practice, I realized a few things. I can't treat LightForce brackets like stock brackets. There's just no way. And there's really no point. These are custom appliances. So we're not in a situation where we have to constantly have oversight, seeing them in the practice, making sure that, everything we've done, every bend we've placed is expressing the way we'd hoped. Now we actually have a sense of what should happen. And so for us, that meant a few things. Number one, we started to focus on creating impact appointments. What I mean by that is we combined redundant appointments. And I'll explain to you a little bit more later why and how we did that. Second thing is, I think for many years, especially, at least what I was hearing, people are always trying to shoot for seeing more and more patients during the day, getting more and more assistants in chairs and patients in chairs. And I think, at least in my area now, with the challenges that we have with, training and getting good people into the practice, I think that's a little bit of a thing of the past. I'd much rather be happy seeing 50, 60 patients a day and seeing them for something that really matters for their progress. And so what that meant was we were also now pushing people anywhere between 2 to 6 months. And we were really introducing things that allowed us to combine the same approach that we had with our clear aligners now with our brackets. And that was such a big moment as we've worked so hard to get to the point where we've changed our schedule and eliminated a lot of these redundant appointments. So with that, I think there's a few observations. Number one, get on your sevens early. If you're going to go ahead and indirect bond, you might as well start early with your sevens, because the time you get to your second wire, you're going to want to be able to engage into the sevens. And so one of the things I would recommend now is get on your sevens the first or second visit, because otherwise you're just spinning your wheels. You're going to go forward to come back. You don't really need to worry so much about a pan repo. So you're just thinking about, how do I go from point A to point B? Second thing, start the elastics and the power chains earlier than you think. You're going to open up spaces a little differently. And some of you that are using self-ligating brackets, you might recognize this. But as you get into your early edgewise wires, you're going to express torque earlier. And what that means is space is generally going to open up. So you're going to need to change sooner than you ever thought. And you can also, because of that, start to run elastics. And so that's a great way to stay on task, stay on point as you're seeing your patients. The other recommendation that I would make is let the first and second arch wires express. You do not need to see them back within a few weeks, a few months. Frankly, it's like watching paint dry. You might as well let them go 10 to 14, maybe even 16 weeks, and let that wire express so that when you see them back, you are now changing that wire. You're going to hold an impact appointment, right? And then what you're going to do is continue to proceed forward with their progress based upon your digital blueprint. And then one of the things that we've also realized is that try to use things that continue to apply force, like NiTi closing springs, hooking up to surgical hooks, things that really will continue to progress the case forward, even if you're not seeing them every few weeks, especially if you're trying to close spaces. So here's here's a good example of a case in which we started early class 2 elastics. So we had an impinging overbite. In this case, severe proclination of the front teeth. You can see how beautifully those front teeth have already started to upright because of the torque prescription. And then we're just retracting with early elastics. And so this is pretty amazingly just 8 months into treatment, and he's nearing the end. And actually, we just finished him up this week. So one of the big keys that I realized during this process, if we're going to let patients go out further between appointments, is we still have to have oversight. We still have to make sure we're taking great care of our patients and doing it in a way where they feel connected and attached. Very similar to what I described when we first started talking today, when we were doing virtual appointments. And so what that meant is I had to really commit myself to remote monitoring. So for many of you, you're already doing these things. Here's just an example with an aligner patient. This was one of my early patients that we saw initially where we were using the dental monitoring device, the scan box, and she had moved to Australia. And so here's where they go ahead and scan with aligners and then without, so you get a sense of the bite and the occlusion. And so this was a really fun and cool story because I actually treated her remotely as she finished her treatment in Australia. And at her final appointment, we had her parents there. She was there. We did a Zoom meeting. And it was just really fun because I think we were all, in a sense, kind of proud of ourselves that we could do this with such a far distance between us. And, it really opened my eyes as we continue to see patients. Many of you are experiencing this mass migration around the country. And so that's really meant that we've had to take even better care of our patients and find a way to connect in a whole different way. And so the value of remote monitoring is that it really ensures progress and oversight. What I mean by that is we don't let people slip through the cracks anymore. I actually have a dental monitoring coordinator in the practice, someone who is monitoring constantly our remote care, making sure that everything is going as it's planned. And so, of course, she's recognizing some of the alerts and the notifications from the AI. But what it's allowing us to do is make sure that we're actually taking better care, have better oversight of our patients, and we're not letting people fall through the cracks where, they show up and all of a sudden we've wasted months in aligners or brackets have been off and we didn't recognize it because we let them go 4 months between appointments. That's how we're creating impact appointments. It's also allowed us to eliminate or reduce our check appointments in the practice. And this is something that I want to kind of touch on as we go into some of the monitoring, which is a goal-oriented approach. And so let's start here with a patient who comes in for phase 1. She's got lip entrapment and impinging bite and crowding, as you can see. And so what we decide is, okay, we're concerned about the impinging bite and entrapment primarily. And so we're going to do something in a phase 1 to correct the bite. So what we do is we go ahead, get the LightForce brackets on. We go ahead, and this is a scan, and she's scanning every 2 weeks, a scan at the 8-week interval. So historically, this is when I would have seen a phase 1 patient back, or even in many cases, our self-ligating comprehensive adolescents. And so at this point, I'm looking at this and saying, well, we actually can let that wire continue to express. And when we see her back, we can probably then change into an entirely different wire than we would have if we'd seen her at the 8-week mark. And that's where you get your impact appointments. And that's really what I would encourage everyone listening to do is try to make sure that when the patient comes in, you're doing something for them. It's not just a check or a retie. Because honestly, especially right now, they don't necessarily want to come in, see you for that. We want to be really, really proactive with our care. And this is what's allowing us to do it. And so here she is now at the 16-week interval. We've been monitoring throughout. We went ahead and put in edgewise wires. As you can see, they're both on the upper and on the lower. You can see how nicely she's leveling out already. You can see the beautiful torque expression there in the anterior already. We're 4 months into this case. And then we're going ahead, like I said, and we're pulling back some of that space because even though I want to make sure there's room for those canines to come in, right now we really started to open up space with the early torque expression. And then this is just a photo that you see of her at the 24-week interval. And this is something that was done from a scan. So we will see her back in probably another 6 to 8 weeks and hopefully get into final wires and probably put like a power chain upper 2 to 2, maybe even a coil spring if needed just for the canines. But this is a really exciting thing that now we can do a case like this where we see the patient for 3 or 4 visits in the practice as long as everything goes as it should. All right, so what I alluded to earlier was this goal-oriented approach using remote monitoring. So one of the really cool innovations now is that we can set up goals specific to our patient using remote monitoring and allowing us to avoid bringing in the patient for some of these unnecessary check appointments. So let's take this example, which the patient is kind of an end-on class 2 or week class 1, where we want her to wear elastics. But realistically, as she's wearing her aligners and her elastics, we don't necessarily need to see her for any reason in the office other than just to check where she's at with the occlusion. So here we go. You can see she sent in her scan at aligner 20. What we recognize, we want to do this, of course, with the aligners off the teeth to really confirm where the bite is. If you have any issue with the patient and the way they're biting, that's where they really need to be coached, either by your coordinator or in the office, and that's, at your discretion. But in this situation, it allows me to say, okay, at this certain point, we should have achieved our goal. If not, what do we do moving forward? And so in this patient's case, I've asked her to continue wearing the aligner at nighttime because at this point, the midlines are about, I think, 0.5 millimeter off, and we have a front photo for that. And then that allows me to say, okay, we want to back the movements up with her deep bite correction as well with the elastics. So with LightForce brackets, we can use kind of the same technique. And I think if I was to suggest one of the biggest steps forward with bracket systems, it's going to be this, because there's a few things that people don't realize yet that we can do with remote monitoring. Number one is we can create these goal-oriented approaches so that we don't have to bring our patients in to just check where their bite is. But number two, we are now able to start using the AI to assess the passivity of the wire. What I mean by that is pretty soon we'll be at a point where once this aligner gets passive, we'll be at a point where once the wire gets passive, that's when we actually bring our patient in on demand. And so let me focus here though on the goal-oriented approach, because as you can see, we're notified with our remote monitoring system that the patient is class 2. And this was the first day, I believe, that we bonded the brackets. So what you can see is this patient, again, class 2 patient, deep bite. And so we're starting early elastics. What you can see here as we go from March to September is that the patient has worn their elastics really well. And now, because we have subsequent scans every 2 weeks in this situation, we're actually starting to understand that the patient has gone from, on the right side, what was more of an end-on class 2 to a class 1. And on the left side, you can see we're getting really close to a class 1 cuspid. And so it's indicating here that we're only now about 2 millimeters off. So what we can do is we can continue to tell a patient, keep wearing this, and then set another timeline for when we would want to check back. And that allows us to basically avoid these redundant check appointments. And in doing so, make sure that we're still progressing the right way with our patient's treatment. And so again, you can really see the power of those custom bite turbos with the deep bite correction, as well as just how amazing this is that we can now do this over the screen. So here's the takeaway. In a digital practice, braces aren't just braces anymore. You can't treat them like our stock braces, and you really want to think about how do you mimic the same thing you're already doing with your aligners to treat your patients. Because the best way you can make this work is to really create this workflow where everything is based on a digital practice. So let's just start here with one patient. So I'm going to show a few examples. So this is Ben. Ben comes in, Ben recognizes that his teeth are flared, and he shows a lot of his lower teeth when he smiles and not enough of his upper teeth. So what we talk about when we're evaluating Ben is we're talking about, okay, let's start with not only our typical standard photos, our x-rays, but we also want to get a facial scan. So we're going to do a LightForce face mapping here to be able to get those teeth into the right position. Again, you're not positioning brackets anymore, you're positioning teeth. So let's look here. What we can see, and this is just the way I was taught and trained, as we're looking at a lateral ceph and identifying how far we want to move those teeth to get the best possible smile, we're thinking that we really want to get the upper incisors about 3 millimeters below that yellow line, because that's where the lips meet and that's the occlusal plane. And so what we're seeing is that in this case, we're also going to have to retract the teeth. So we're going to have to work on getting a custom torque for the teeth as well in order to upright things as we not only extrude, but retract. And so when we look here and we apply this face mapping technology, what I've done is I've moved those teeth down into a position where I kept the simulation up so you can kind of see exactly how far. We're right about 3-4 millimeters there, but see exactly how that's really going to change Ben's smile. In these situations, because these are early phases of development with the face mapping, the gum tissue obviously is not responding as it might in the patient's actual mouth, but it gives you an idea. Now we're creating a smile arc that makes sense for our patient, and we're applying that digital blueprint to his care. And so you can just see here, I've kind of zoomed in to identify exactly how far we wanted to move those teeth as we're uprighting and extruding. So here he was. So this is between basically his initial bonding appointment and now on his scan before we're going to see him in the practice for an arch wire adjustment. So the way I designed his brackets, he's bidimensional, upper 2 to 2. He's 018 in the anterior, 020 in the posterior. And that was because I really wanted to engage those teeth in the anterior early to start the extrusion. And you can see this. So when we're talking about, June to September, we're now a few months into treatment and into his care. And you can see how that wire is now ready to be changed into a new edgewise wire, which is what's so great about this is we've now gone months between his initial bonding and when he's ready to come back and see us. And so we're able to get everything set up the right way and continue to progress with his care. So here's another patient in our practice, Alan. Alan was actually the second patient that we had in our practice to do LightForce. We'd actually seen him prior to closure. And then once we came back into the office, he came back and we talked about the benefits of custom brackets. He had been planning on doing clear self-ligating at that point, and we talked about the benefit of doing it with the custom braces, and I think he's really happy that he did. So what we've done here, here's his initial occlusion. You can see the anterior crossbite. We can see the crowding. One of the things that it was probably hard to appreciate on his initial photos was that in full animation, he also had an excessive gingival display. But what we're doing here is we're really designing the brackets based upon the tooth position. So what we're doing, like on upper right 2, is ramping up some of that torque to make sure that we get the root in the right spot as we finish. But the reason that matters is because you're expressing that prescription really early on when you're getting into an early edgewise wire. And so one of the great things that you'll notice is there's a lot of variation, especially in those anterior teeth, in terms of your torque, potentially your tip as well. Depending on exactly what you want to achieve with aesthetics. Maybe you need to avoid black triangles. Maybe you can't do enough IPR in that situation. There's many indications to really dial in your prescription to make sure that everything gets in the right position. And again, it's about getting the tooth in the right position. So here's Alan upon finishing. I think it looks really nice. Obviously, there's a few things, and I'll critique them in a second. But you can see here our setup that we did digitally based upon initial scan, and then where he finished at the end. So what I had done is I used 020. He was using, like I said, he was one of the early patients that we had. Like I said, I think he was our second patient. And so we only have the white bracket at that time. Now there's the clear. And I would say more patients than not choose clear now in the practice. But Alan was a patient where we only saw him for 5 adjustment appointments, and he had 1 emergency. So I had initially estimated for Alan right between 20 to 24 months of treatment. Well, we finished him in 13 months. And, when looking at the case, this is, in my mind, a really nice result. We were able to manage the smile nicely. We were able to manage the malocclusion. We were able to get things in a really great position in an efficient period of time, and frankly, get the roots in a great position in a great period of time. And so as we look here, I promised I would get piggy on in this situation. You can see that we probably didn't fully express the torque that had been prescribed. I did finish him in a 1925 Nitai. I probably could have advanced to a stainless steel looking back just to really get that nailed into the right spot. But again, I think we can all appreciate that this is a really nice result for him in a great time frame. And he was really excited about his smile. All right, as we finish up here, let's circle back to Jen. So I just want to show you Jen, not because she's this amazing case. In fact, we haven't even finished her care yet. But I want to talk about Jen because Jen has bought into what we're doing in our practice. She appreciated so much everything we did to set up her digital treatment plan, to show her and communicate with her what to expect, and then really deliver on the promises that we discussed at her initial exam. And so here is Jen. Here was her initial bonding. You can see this is a great color for the whites. But what we recognize here is that in this situation, we are discluding the bite. We have the crowding. This is going to align really quickly. And so we can see here that as we see her back in 3 months, a lot of that early alignment had already happened. And now at this point, it's really time to either finish some of that alignment, get into a wire that's going to fully engage some of those front teeth, or start getting into an early edgewise. And so that is something that is really your choice. And honestly, something where I think in our practice, what we've done is we've tried to reduce the number of wires as much as possible to just have like 4 basic wires that we're using in these situations. And that's something that you can evaluate in your practice too. You can almost go too far with trying to customize every single thing in the practice. You're almost better just to stick to like 4 wires and then build your systems around that. And so this is her just a few months in, and you can see as we got those wires back in, put the colors, we're already starting to see improvement. But at the same time, she's still showing too much gingival tissue upon smiling, and we still have misalignment and an overbite. So at this point, we go ahead and we're going to put in our TADs. We're going to go ahead and start pulling those TADs in a way pulling on those TADs in a way in which we are actually intruding. We're now expressing with our torque prescription in the posterior, some of that palatal root torque to get the expansion that we want. We have our chains on because we're going to expect now that we're in edgewise wires that we're going to express that torque and we're going to get spacing. And then we're also going to back some of that up with our class 2 elastics that we talked about. And so here she is at the 6-month mark. Overall things are going quite nicely. You can see here that I've actually gone from our 4s to the 7s. And essentially that was just to get kind of maximum pull as we're also intruding in the anterior. I didn't want to offset some of my forces. So this was Jen. This was actually when she was visiting her family. And Jen knew that I had an upcoming lecture. And this is why I brought her up again, because Jen was so appreciative of what we've already done that she shared this photo from her family farm in Missouri. And the reason I say this is because she has bought into this digital experience. She's bought into everything we want to do. She actually told me when I saw her again that a lot of her family thought she'd had jaw surgery because of how much her smile has changed in such a short period of time. And so she's just so thrilled by the fact that she's getting the smile she's always wanted. And so I think that's the point of all this, is that everyone in your practice really has to be inspired. It starts with you. It really trickles down to your team. And as it does, it just fills up the space. And your patients are going to be so much more excited about going through a process in a more efficient way, a customized way, and a way in which we're really communicating much more closely as the doctor to the patient. And so on a final note here, I would just kind of charge everyone with this. If you haven't started to think about what your future practice looks like, I think it's probably time to start doing that. There's a lot of other options out there. There's many different ways to enter into custom digital treatment. But I think, LightForce really is a great one. It has been great for me. And so the future really is a digital custom experience. And I think we just have to all look at ourselves, look at our practice, and see what our future looks like. Okay, thank you. So now we're going to take some questions from the audience. And so it looks like there's been a few questions that have been sent over. So let's start here. So how can LightForce financially benefit my practice? Well, that's obviously a good question. I think for years we've been talking about the share of the chair with aligners, and that's something obviously that Invisalign created. But I think it's about more than that, because the same rules apply in a sense when you're seeing patients for fewer visits in your practice and you have this lab cost up front. But I think it's a lot of this is about how do you change the capacity in your practice. Specifically with each patient, I actually have run some numbers now that we've started to finish some of our cases. Of course, for everyone based on their fixed costs, for their team, for their space, for their materials, this is going to be a little bit different. And what your fees are really will affect this per appointment charge. But what I've really found is that compared to my analog braces, we're at about $600+ per adjustment. Whereas before it was about $300 to $350 for our self-ligating brackets. And so for us, that's a big difference. We're seeing them fewer times. For a lot of us, the range is anywhere from $200 to $400 to bring somebody in and sit them in a chair. And so we really want to make that an impactful appointment. And that's much more consistent with what I was seeing with my aligner treatment. And so it's really what your cost of the chair is, but there's definite benefit. And then it opens up the capacity in your practice. So if you're having trouble getting people started, you're no longer saying, hey, you want to do a same day start? We'll put some braces on today. Your start is a scan. And then you're able to walk through instead of just randomly putting on brackets and taking the steps in a way in which it doesn't really feel disciplined. You're going to be able to sit down, go through your digital setup, create a digital blueprint, and then be really confident that that's how you're going to get your patient to the finish line. So I think there's a few different points to that, how it benefits your practice. Okay, second question. How is LightForce's clear bracket different from other clear brackets? So I think this is a good question. Keep in mind that there's different types of clear brackets. So in LightForce's case, I would say that compared to some of the others that I've used, it's a little lower profile. I think the aesthetics are better. Oftentimes when we're looking at the way it almost shade matches the tooth, you're going to see a little bit more aesthetic appearance. But with that said, I think it still is funny that I see a lot of our adolescents and younger kids choose the white bracket because it pops colors. And so I think there's still a place for the white bracket. I think the clear bracket moving forward is going to be kind of the leading bracket for LightForce. And I think it's something that allows you to kind of open up your LightForce care for your adult patients and some of those teens that want a discrete option. But I think primarily the biggest difference is that it has this great aesthetic appearance that's more of a shade match than some of the others that I've seen. Okay, how are LightForce's IDB trays different from what's on the market? So we touched on this a little bit earlier, but it really is a custom fit to those teeth. So there's a few things you want to understand. Similar to when you're using aligners, you really want to have a turnaround time that allows you to have a very similar position of the tooth from the time you scan to the time you bond at delivery. And with that, you're going to expect that you're going to get a great fit. So LightForce's IDB system actually engages on the occlusal or incisal, and then you're just putting light pressure at that line angle. And so different than what I personally have used before and some others have used before, there's a reproducible way to treat and to teach your assistants. And so it's something that is really similar to using your attachments for aligners. It's frankly a very reproducible way to bond brackets. And really it just comes down to proper isolation and to bonding the right way and using the right techniques. All right, next question. How much training do I need to get started with LightForce? Well, I would say minimal. For us, when we first started, we were one of the early adopters in our practice, so we really didn't get much formal training. With that said, there's a great training team now, and I know they're happy to come out and help people as they enter into this process and start their first few cases. But if you are a practice that's already doing a lot of aligner care like we were, you're going to really easily adopt similar techniques and be able to start treating your cases with LightForce. There's not like this great need to go through all the steps in detail if you're a practice that's already doing a lot of aligners. So I really don't think that it comes down to how much training you're receiving. It's just making sure that you stick to the fundamentals, isolate properly, bond properly, and then use the proper techniques to make sure that you're using the IDB trays properly. Okay, so why don't we take one more last question here. Any tips for people who are just getting started? So I think for those of you who are just getting started, you're doing the right thing by listening to people speak who've already done a number of cases. I think you have to familiarize yourself with why this is a better process and approach for your patients and how essentially this changes the roadmap in your practice. And what I mean by that is you're no longer kind of fighting between braces and aligners. You have this balance all of a sudden. And again, like I said before, your capacity changes greatly. And so what I would recommend is that you look through best practices. There's a lot of educational material now that's been developed by LightForce, which can help with that. And then I think what you would do is, at least what we did, is I identified my best assistants at bonding attachments. And those were the ones that we initially worked together as a group to bond with. And so everyone watched them initially bond as I was there helping. And then it was kind of like once one person was ready, then they trained the next person and we went down the line from there. And so it was almost like getting approval to remove cement from a tooth. You're making sure that that assistant knows exactly what to do and how to do it. And so that's the best way to get started. In terms of how to do the digital setups, that is something where I think it takes maybe a little bit of time. It takes a little bit of perspective and a little bit of experience to make sure that you're looking at the right things. And so your optics will change over time. But kind of like I showed on a few of those cases, you may in some cases need to ramp up torque on a tooth where upper right 2 has 3 more degrees or 4 more degrees than the upper left 2. It really just depends on what you're trying to achieve out of that particular case. But in general, I would say this. Most of us, I think at this point, are treating with 020 as far as a slot size. I like the bidimensional with some of these cases where I need early torque expression or high torque expression, or phase 1 cases that we're treating now. In terms of the way that you want to manipulate the setup, keep in mind that it's different than your liner setups where previously you were over-engineering a lot of the movements like extrusion and rotation, or for that matter, intrusion. Now you're predictably going to move the teeth into that position because you now have a wire that dependably and predictably is going to get the tooth into the right spot. So what you're really just doing is continuing with your digital workflow, which is a big part of all of this, creating systems that mimic your aligner care, and then just going through the process in a way that is really intuitive for not only your team, but for your patients. Okay, great. So thank you everyone for joining us today. Hopefully you learned a few things. Feel free to reach out if you have any questions. I'm sure we can provide you some of my information or contacts. And thanks for listening and learning a little bit about what we've done in my practice to become 100% digital. Thank you all.
Thank you everyone for your questions. If we did not get to your questions, we will answer it after the webinar via email. Please be sure to take the free CES quiz associated with this webinar. Shortly, we will send you a recording of this presentation and instructions on how to access the CE quiz. Thank you all again for attending, and a special thank you to Dr. Blake Davis and our sponsor for this webinar, LightForce Orthodontics. Thank you and have a great day.